Welcome to the gastric balloon video info bit. There are 3 intragastric balloons approved in the United States. Although they are relatively new here, they have been in use outside the US for over 20 years and have an excellent safety record. At Journey Life Physicians, we offer only the Reshape Duo and the Obalon gastric balloon systems, as we feel they have the best weight loss and the lowest complication rates. Gastric balloons are made out of soft silicone. In the case of Reshape, it is inserted by the physician while the patient is under sedation with a scope. In the case of the Obalon, the patient simply swallows a capsule in the office, and in most cases can go right back to work. A total of 3 capsules are utilized with most patients over a course of 9 to 12 weeks. No incisions are required for gastric balloons, and most patients who work hard and follow the recommended diet and exercise instructions can lose 30 to 50 pounds over the course of the program. Procedure video. Generally speaking, patients with a BMI below 40 are the best candidates for a gastric balloon. In fact, the FDA has officially approved balloons for patients with a BMI in the range of 30 to 40. We do sometimes place balloons in patients with a BMI above 40, however this is what is known as off-label use. Patients with an aversion to a surgical procedure also can be good candidates. Gastric balloons have an excellent safety profile, however any procedure comes with some risks. Perforation of the stomach or esophagus is a rare possibility. Aspiration of gastric contents into the lungs is a possible risk, as is rupture or leakage of the gastric balloon, which could potentially cause a blockage of the small intestine. Overgrowth of bacteria in the stomach leading to nausea, cramps, diarrhea, and fever has been reported. Lastly, the most common side effect is nausea and vomiting, which in some patients can lead to the need for early removal of the balloon. Studies have shown up to 40% excess body weight loss at 6 months with gastric balloons, which would equate to 40 pounds in someone who is 100 pounds overweight. As our practice has extensive experience with weight loss medications, you have the option of augmenting your results by adding a medical weight loss option as well. Most importantly, gastric balloon patients must commit to a lifestyle change over the course of the 12-month program in order to keep the weight off in the long run. As far as cost, the Reshape is $7,000 and the Obalon is $7,500. Note that these prices are subject to change without notice. Frequently both companies will offer rebate programs, so check the website page for each device for current pricing. Each program is 12 months in duration and includes insertion, removal, and 12 dietary visits. If you have an HSA or flexible healthcare spending account, you should be able to use it for payment on a gastric balloon. If you need financing, just click on the financing options link just to the right on this page and you can fill out a quick online application and find out if you're approved in just a few minutes.